Hello and welcome to Talking Meds, a podcast from PrescQIPP, engaging conversations about medicines-related dilemmas. I'm your host, Jonathan Underhill, Medicine's Clinical Advisor here at PrescQIPP. Hello and welcome to the latest edition of Talking Meds. I'm delighted today to be joined by not one but two guests. This is the fifth episode in our series on caring about medicines and care homes with Jonathan and Sundus. So I'm joined again by Sundus Jawad, who you all know. Sundus has got over 25 years experience as a care homes pharmacist, medicines optimisation pharmacist, and I'm delighted to have her here again. But we're also joined by Jane Shanahan, who is a pharmacy technician. And again, Jane's got over 4 decades of experience working as a pharmacy technician. Currently, Jane works with the Specialist Medicines Optimisation care home team in East Lancashire, where they provide expert support to lots of care homes throughout the region, giving comprehensive medicines optimisation, crisis turnaround, staff education and training, and detailed medication reviews. So really interested to find out from Jane what a day looks like for her, how she works with other people within the multidisciplinary team and other people within the pharmacy team. But in particular, I want to talk to Jane about 2 projects she's been involved with. One around anticholinergic burden and how we can help people reduce the number of anticholinergics they're on if they're causing them problems. And a lovely project which is called Find Your Evelyn. And we've just had a conversation about how do you pronounce Evelyn? Is it Evelyn or Evelyn? The lady you're going to find out about, Evelyn, is from the northeast of England like me. And I said, yes, it's definitely Evelyn from the northeast of England. So we're going to talk about the Find Your Evelyn project as well. Also, Jane's also in her own time done collaborations internationally in New Zealand, sharing best support over there. So as I said, delighted and honoured to have Jane as a guest on here. So Jane and Sundus, hello and welcome. Jane, do you want to just start telling us a little bit about your career journey so far and how you ended up working in care homes?
Thanks, Jonathan. Absolutely delighted to be here. Thank you so much for this invite. Really exciting to be part of this podcast series on care homes. So the starting point for me as a very young person was in community pharmacy, and I'd just passed my driving test. And what used to happen was my wonderful manager used to say, Jane, do you want some more practice at driving? And I was desperate for practice. I probably still am. Desperate for practice. And so I used to deliver medicines to people in sheltered accommodation. And that was wonderful, really, because I could start to see how they were managing in their own environment. The fact that as a pharmacy delivery driver at that point, quite often, sadly, I was the only person that person would interact with sometimes in a period of weeks. And I would drop off these huge bags of medicines, and a month later, I would potentially collect lots of medicines that had never been used. And I remember thinking as a young person back then, there's got to be a better way. What can we do to support these people, to help them with their medicine regimes, reduce medication waste, but also help them to be more connected with services within the NHS. The second or the middle chapter of my career then, some 10 years later, began working in hospital pharmacy in the northeast of England, multiple hospitals, and also the northwest. And I always found myself gravitated to older people's wards. And there I could see the serious consequences of how the decline in health and medicine-related issues could lead to a hospital admission. And many of these medicines-related admissions were due to falls. And sadly, I always then observed painful transitions for people where they were then transferred into a care home because they'd lost their independence and they needed a higher level of care. And again, I remember thinking how can we help people to remain independent, to reduce falls and other medicines-related harms? A number of years later, I then saw my current role advertised, and I thought, wow, that sounds a perfect opportunity to support people living in care homes. And I've been fortunate and privileged now to work with the Meds Optimisation care home team in East Lancashire for the last 11 years. And I felt that I could finally bring all of that vital experience over the last 20 years into the current role supporting social care. So I'm very privileged to work for this team of dedicated professionals in East Lancashire. We're very lucky to have a commissioned service to support social care colleagues across every nursing home and residential home in East Lancashire. And we are part of our family and community care group within East Lancashire Hospitals. So because of that, we're able to access multiple community services, intensive home support service, obviously district nurses, care home nurses, because it's really important to say that this is a team effort to support vulnerable people in care homes, because particularly of the challenges that social care providers and their teams experience on a daily basis and the barriers that they often face.
So yeah, thanks for that, Jen. So I guess having pharmacy technicians on your team is clearly a beneficial thing. I see Sundus sort of smiling and nodding in approval of what you were saying there as well. So Sundus, can I ask you, and just in terms of pharmacy technicians in your team, how does that work, and what do they bring to the party?
Well, they bring quite a lot to the party. In fact, we probably wouldn't be able to do our work as effectively as we do without them. They're a vital part of the team. I mean, particularly people like Jane, who's 20 plus years experience working with older people. I mean, that is just absolutely fantastic. I didn't know that, Jane, so I've just found that out. No wonder you're so good at what you do. So yeah, they're a vital part. And if we think about the pharmacy team or a MOSH team or a MOCH team, depending, medicines optimization care homes team, you have the pharmacist. So there's a clinical kind of role there. So that there's a focus on the clinical work from pharmacists. And then you have pharmacy technicians who complement the clinical work and sometimes actually do quite a lot of the prep work for clinical work. They can identify clinical issues and pass those on to pharmacists. But, they do quite a lot of work, in the background, all the medicines management work. So I know Jane's just mentioned about working with social care. So if there are concerns around inappropriate use of medicines, inappropriate storage, if there's concerns around errors, safeguarding issues, our pharmacy technicians do a wonderful job with working with social care. That multidisciplinary working that you mentioned. So there's really vital role across lots of, interfaces. So it's not just with our colleagues in secondary care, they're interfacing with our colleagues in social care. They're working with carers on the ground, care managers, care home staff, others from the multidisciplinary team, speech and language therapists, for example, all sorts of work. So really quite diverse. I think one of my technicians, Dara Thacker, who's, been a fantastic pharmacy technician in our team, she's always saying no one day is the same because every day there is something new and, a new query or a new request for support.
Yes. So I mean, one of the questions I had in my head about asking you, Jane, was what a typical day looks like. But from Sundus' description there is no such thing as a typical day. And that's actually very similar to other people that I've had on the podcast as well, who work as in a generalist role, where you're not working as if you like, as a specialist. Well, you're a specialist generalist, but you see all sorts of different people within your care home, don't you? So I don't know. Can you describe what a typical week might look like for you, or a typical day?
Yeah, no, I'm delighted to, absolutely. This is the best role I've ever had. It's just phenomenal. So again, one of the phenomenal things that you've touched on is that no 2 days are the same and no 2 weeks are the same. And colleagues and listeners supporting care homes would probably agree with that. You essentially need to be highly versatile, highly mobile. You need to be absolutely extremely enthusiastic and very dedicated. Huge amounts of job satisfaction will then fall at your feet, absolutely. For me, the day would start with a few minutes of triage and planning. So as a service, we have a referral inbox. So we'll look at the inbox, see what kind of queries and things have come in over the evening. We'll factor those tasks and prioritise around a work plan that we've already got. And for me at the moment, that would be undertaking comprehensive medicines management audits. So I'll then head out to a care home, it's already planned in, and I'll undertake a comprehensive medicines management audit, which will cover all the themes of medicines management, as Sundus has already touched on. We'll then have a meeting with the care home manager and offer feedback. We'll provide a comprehensive report, and we'll factor in numerous resources and support, training, and anything that's needed with regards to, themes that have been spotted during that audit. And again, if we identify any incidents and any errors, we can support with root cause analysis and look at that as well. Our pharmacy technicians undertake medication reviews. We are all very competent and highly experienced, but what we find is we need to support care homes with the fundamentals, the basics of medicines management, to get that right and to make sure they've got the support that they need.
I think you're right as well. And as Sundus has said, sometimes you need a team in place where all the bases are covered, so you can do things that potentially look quite straightforward and quite simple, but sometimes you uncover things that have greater complexity. And like with all teams, it's about knowing where your scope of practice lies and knowing when to get help from other people, where you're potentially working outside of your scope of practice. All of the pharmacy technicians that I've ever worked with do that brilliantly, actually. Really, really well indeed. So just in terms of other pharmacy technicians who work in care home settings then, how do you all stay in touch with each other? Because there's nothing worse, is there, than being, professionally isolated. And even though you're part of a team, if you're the only technician on the team, it's important that you stay in touch with other people like you, isn't it?
No, absolutely. And I'm a huge advocate for networking, collaboration, partnership. Absolutely very passionate about that. So when I was fortunate to start my role, we were on the MOCH programme, Medicines Optimisation in Care Homes programme. And that's where I met a number of pharmacy technicians back in the day. And that was in 2018. And even to this day now, we're still in touch with each other all the time, sharing good practice, outcomes, negative things that have happened, how we can all learn and gain experience from these dilemmas that we face, really, and challenges. Another great way to keep in touch is PrescQIPP's sort of virtual professional groups for care homes and pharmacy technicians. And if you can't attend on the day, you can check out the slides and recordings at a later date. They're brilliant. Also, there's our own organisation, of course, so the Association of Pharmacy Technicians, APT UK. Again, a wonderful place to join in with webinars and present and get to know people. We've also got the National Pharmacy Care Home Faculty, again, another wonderful place to connect and collaborate, work in partnership with people. And I would also support pharmacy technicians that are maybe new in role to reach out to their primary care networks or they might already be working in a PCN. So reach out to the MOCH colleagues working in care homes, see if you can shadow them. Because quite often you find that we're all trying to do the same thing with slightly different pieces of work. Whereas if we've got more of an understanding of how we work, it avoids duplication, improves quality really. So they're just some ideas of how to collaborate and keep in touch.
No, that's brilliant. We'll put links in the show notes to the virtual professional groups and also the other associations. As you say, networking is so very important. PrescQIPP can help with that, but there's other people that can help with that as well. So I mentioned at the beginning that I'm particularly interested in a couple of the projects that you've worked on, Jane, with Sundus's sort of input into this as well. I'm really interested. Just so tell us a little bit about the project that you worked on anticholinergic burden.
Delighted to. This was a project, again, it was a quality improvement project that I had to do as part of the MOCH pathway with CPPE. And the first arm of it was where, as a team, we would calculate the anticholinergic burden score of every resident in the care homes that we supported, and that was about over 3,000 care home residents. The ones with an ACB score of 3 or greater, or those that were showing potential side effects of anticholinergic burden, whether that would be dry mouth or something more significant, cognitive impairment and falling, we would review those for medication review as well. And then we started to see some wonderful positive outcomes. We had stories of where a daughter said, "Thank you for giving us our mum back." The lady could lift her head and her cognitive improvement had increased. There was one gentleman that no longer needed his walking frame. And the positive outcomes just came thick and fast, really. The second arm of the project then allowed us to work closely with secondary care colleagues in the pharmacy department. And together we implemented a clinical ward-based pathway where every adult would have their anticholinergic burden score calculated by pharmacy technicians, and that information would be passed on to the ward clinicians, where they would see whether the potential reason for admission due to falling, fecal impaction, etc. And deprescribing would begin to happen on the ward, or if time didn't allow that, that information would be added to the discharge summary. So that would, support colleagues in general practice. And again, the feedback from everyone with that arm of the project was significant. Then very recently, a number of years later, and this is where, for me, when you've got a goal and a huge passion, you just keep calm and carry on. And when the journey seems long, just don't give up. And we never did, and we knew we were onto something. So we then became very passionate about collaborating with social care colleagues on this project. And we wanted to empower them, and we wanted to give them the information about anticholinergic burden awareness. And one provider absolutely ran with this. And rightly so. They said to me that, Jane, we're the ones that are giving the medicines to these people every day. We are the ones that will see the subtle changes in the resident where they may be falling more often, or they are a little bit more constipated. And if you show us what to do, we can pass that information from inside the care home to external clinicians. And that's what they did. And this care home group then launched a national campaign called Find Your Evelyn, where they calculated the ACB score of hundreds of residents across the whole care home provider group in the Northeast, 9 care homes, started to see these wonderful positive outcomes. And one particular lady called Evelyn, who was 101, actually says in the video, and the video is part of the campaign, it's there for everyone to see. She's actually saying in the video words to the effect of, I've got my legs back again. And the joy on her face is a delight for everyone to see, really. So we are hoping that other care home providers will jump on board, will contact pharmacy professionals and ask how to do this. They then could help them set up a pathway with the GP practice to get this information sent backwards and forwards. Because I feel very passionate to say that people that live in care homes are in the last chapter of their life. And while one of them said to me last week, they said, Jane, it's wonderful that we have a 10-year plan for the NHS, but I'm not going to be around in a year, let alone 10 years. I need help and support now. And so, again, you can hear the passion in my voice, very passionate about this project, that we could support a lot of people with this.
Yeah, Jane, that's brilliant. We did a series with the geriatrician Lucy Pollock on talking meds last year, and anticholinergic burden came up a lot in the conversations Lucy and I had. As a geriatrician, as a care of the elderly consultant, she saw this a lot, and she also saw the impact it can have when that's carefully managed. And there's a person-centered medication review where you ask the person or their carer, what is it that's important here? And what is it that you're struggling with? And often it's the medicines with the anticholinergic burden that are actually causing the problems, and stopping them carefully can, as you say, transform people's lives. We'll put a link to the Find Your Evelyn campaign in here. There is a video, listeners, on YouTube that's linked to it. All I'll say to you is have tissues with you when you watch that video. I certainly needed to have tissues when I watched it, because the transformation in this delightful 101-year-old lady called Evelyn was tremendous. And the idea that everybody knows an Evelyn or will come across an Evelyn at some point, either in their lives or within their professional practice, you'll come across at least one, and you can make a difference if you think about what's important to them or what really matters to them, and how that works. Sundus, again, what have you got any thoughts on this? And have you done anything with this in your locality?
Well, first of all, I think the campaign that Jane has led on Find Your Evelyn is absolutely incredible and needs, recognition. And when she shared it with me, I was just really dumbstruck, as to how much of an impact her work has had And now, we have a national care home group, leading this campaign for all of their residents. It's just fantastic to see. It really, really is. And that's, credit to Jane and how she's led that piece of work in the North, and, how she's managed to have an impact on the very people, the carers in those care homes, but also the families, and to celebrate with them, the patient outcomes, the benefits that this work has brought to people. So huge congratulations to Jane on this piece of work. Secondly, I think, anticholinergic burden, that's nothing new, I think, to those of us who've been reviewing medicines for many years. And I think some of us routinely do it and take it for granted that this is routinely done for older people in care homes, and that, people are measuring or calculating ACB, anticholinergic burden scores pre and post medication review. We take it for granted that this is happening across the country. Unfortunately, it isn't. And it's only, certain pockets of the country where we see this happening, where we've got Janes and people like Jane and other pharmacy technicians supporting on the ground to be able to do this. I think there's also something about, just now as I was listening to Jane, something came to mind, and that's, we're talking about the most vulnerable patients in our society, people who live in care homes. They are, and what you were saying about Lucy Pollock and what she shared about her experiences as a geriatrician. And we've got to remember that people go through a journey, and yes, they are at the kind of, the end of their life when they're in a care home, or edging towards the end of their life. And anticholinergic burden becomes more relevant. There's more significance to it at that part of, or at that stage of their life. We know, for example, I know from my own experience, I've reviewed people who I know have been prescribed amitriptyline maybe for 15 years, and they had no adverse effects from that amitriptyline. But it's now that they're older, more vulnerable, maybe there's a bit of weight loss, the frailty element is definitely more visible, and so that they become more susceptible to those adverse effects. And although they've had that medication for 15 years, it's now that it's starting to have those adverse effects. So I think this is why it's so important to really understand why it's important for us to review those medicines at that stage in their life when they come to a care home, or and to work out pre and post medication review. Can we have an impact? So yeah, this is in terms of in terms of a clinical sense, it is really important for people at that stage of their life, and it should be part of a structured medication review. We should all be looking at anticholinergic burden scores when we do structured medication review.
Yes, I mean, Sundus, you and I worked together on the National Polypharmacy Programme as well, didn't we? And there was lots and lots of people who came along to action learning sets with examples of where they'd made a big difference in terms of anticholinergic burden. It starts with an audit, perhaps, of where you are in your organisation, but it always finishes with that personalised approach, and it's the individual medication review where you see the big changes. So just to finish off, then, we always like to finish off with the what three things should people do differently as a result. So if I can ask you, what do you think the three things you'd want clinicians to think about with respect to these projects?
Yeah, so for me, again, bringing in collaboration, building relationships, fostering relationships, absolutely networking is key, really, and make sure that you're absolutely optimising that. I think secondly, with shared decision making, absolutely at the forefront of everything, consider anticholinergic burden score at the initiation of any new medicine, because we know from numerous hefty pieces of literature that cumulative effect, as Sundus has touched on, particularly in frail and older people, could have negative consequences. Look for alternatives, look for even non-drug options, and certainly review the medicine and see if it's even indicated still in the first place. Thirdly, I would say if you do prescribe one, then consider adding a diary note to the GP notes to make sure it's reviewed, have a plan to stop it. And even if these medicines are started in hospital and there's a need, then ensure that information is communicated clearly on the discharge summary so that general practice is supported. And fourthly, if you can have a fourth one, I would say consider all the wonderful, free resources out there to support you on your journey. So some wonderful stuff on PrescQIPP's website, the newly updated anticholinergic bulletin, 360, it is fantastic, and there's some fantastic deprescribing information on there. There's references, there's links to deprescribing tools. It's wonderful. PrescQIPP has its own e-learning resource, anticholinergic burden, and if you're lucky, they've probably got a fantastic cost-effective sale on as well, so I'd grab that. There's the PrescQIPP Impact tool, there's NICE Guidance 97, there's a whole host of phenomenal resources to support us all with anticholinergic burden.
There are, Jane. Listen, you've just done my job for me in plugging all those wonderful PrescQIPP resources. So I won't be in trouble with Carol Roberts, our CEO, for not mentioning the fantastic resources that we have. So you're right. The resources can help lots and can really help support your CPD in this area. What I would say is that it doesn't matter how many resources you have and how many tools you have. It's the attitudes that trump the tools all day long. If you've got the right attitude about this, when you're looking at person-centered care in care homes, then that can go a long way in making things better for you, for the people who live in care homes. So, listen, thank you so much, Sundus. Thank you so much, Jane. It's been absolutely fantastic chatting to you. Listeners, please have a look at the Find Your Evelyn project. As I say, get a big box of tissues with you when you watch the video, and yeah, maybe it'll inspire you to do something about this as well. Cheers, guys.
Thank you.
Thank you. Thank you.
We hope you enjoyed today's podcast, and we'll see you in a couple of weeks for the next episode of Talking Meds from PrescQIPP, engaging conversations about medicines-related dilemmas. Please follow us on LinkedIn and Blue Sky to join in with the discussions, and email us on talkingmeds@prescript.info with your feedback or suggestions for future topics or guests. Please don't forget to register for access to the PrescQIPP website for all of our excellent resources.